We're going to hear next, our final speaker is Dr. Michele Barry, who's a professor of medicine at Stanford University and directs the Global Health Initiative there. Dr. Barry, if you're with us, can you share your screen and start your slides now?
Great. Thank you very much and good morning. So I've been asked to talk a little bit about the global response to COVID-19. And I think I'll start with this snapshot of various countries with different curves. And I'd like to address the three of these countries in a territory that have been able to flatten their curve and talk about why that may be so. I'd like to concentrate on South Korea. Let's go back to that curve. I guess I can't go back. I'd like to talk about South Korea, China, Hong Kong, and Singapore. And the reason I'd like to talk about this is these were very vulnerable countries and a territory that were proximate to the initial outbreak in Wuhan. And I thought it was very interesting. I asked my research associate to look at how many people traveled from Wuhan before those 2 weeks when the first case and before Wuhan closed. And you can see that 5 million people traveled. So you can understand why this virus globalized. Next slide. It's not moving. Okay. Singapore's strategy was one of strict containment. And they took a very strong travel restriction with strict international travel. All returning citizens had to stay at home for 14 days. They had aggressive temperature screening at the borders, all buildings, all airports, and they had rapid test development. And I think what was really key is not only did they gear up their testing, they had pretty much lax requirements. You did not have to be short of breath. You actually could be tested with just a clinical suspicion by your doctor. There was free testing. And at one time, at their peak, there were over 2,000 tests done a day. So this was the first country to have a confirmed and the highest confirmed cases out of China. But they were very quick to do strict quarantine measure. They did not have to lock down. They did not shelter in place. What they did was temperature testing in just about all public spaces, stay-at-home notice. And if you go to the right-hand side of your screen, this is a stay-at-home notice where everybody, you can see that were coming from a country that might have been contaminated, got to stay at home. They got text messages sent to their cell phone. The government followed their cell phone with GPS so that they knew they were staying in the quarantine area. They might, and this is a little card that was given out, they could get random calls from house visits, from authorities, and they would have to take a picture showing that they were in the quarantine area. So it was quite strict quarantine. The other thing that they did, which I think was really important, was that when somebody was identified as COVID positive, they gave them mandatory hospital or isolation stay. They did not put them back in the house. As we know from the China epidemic, in the first 82,000 cases, most of that transmission, 85%, was within a family setting. So positive people were put in hospitals or isolation facilities. They gave aggressive daily economic assistance for everyone quarantined. They told physicians that even if someone was not COVID positive, all upper respiratory infections were quarantined for 5 days, even if COVID-19 negative. Because we know that our swab testing now at best has about 75% sensitivity. They did strict social distancing, but they did not lock down. What they also did was a unified government response and very transparent communication. You can see that they had daily reports on your WhatsApp messaging. They talked about how many cases were in Singapore, how many were discharged. They gave daily messaging about the situation in the country. They also ran very interesting, apropos of SEMA's communication, comic book chronicles of COVID-19, where they talked about not only what you should be doing, which we get the 5 all the time, but they talked about the sense of social responsibility. Don't come into work for if you're sick. They developed a very interesting app called Trace Together, where actually these are cell phones with this app that communicated with Bluetooth networks and enabled contact tracing for 21 days. And actually, these apps could calculate the distance between people. So you knew if you were coming close to a COVID-19 person. It allowed for early notification, and it was installed by more than 600,000 people in Singapore, and it's now freely available. The benefit of this was that not only were people better informed, the Minister of Health was better informed about who needed quarantine. The con, and we can talk about that, is privacy. Next slide. Let's see if I can do it. Next country I'd like to talk about is South Korea. And what they did was interesting because they did do a lockdown, but what they did was very vigorous testing. And they also prevented people from coming in. They mobilized companies for rapid test development of 100,000 kits a day. They had 600 testing centers around the country. The government asked many of their manufacturers to doing it. And they conducted over 300,000 tests at peak. And I'll show you some of the comparison testing that we can see. So you can see here that we are way below the amount of tests per million people. And that was a very strong reason for why South Korea was very strategic. They had advanced contact tracing using big data with security cameras, smartphone apps, and credit cards. Their data became very transparent. They had regular text message and aggressive thermal imaging at all restaurants, hotel, and large buildings. And they rapidly had new laws to prioritize community security over individual privacy during the outbreak. But again, they were able to do containment with a lack of strict lockdown movement restriction. China's strategy, we all know pretty much about, but I just want to highlight some of the interesting approaches they took. We all know that they had a very bold, aggressive approach that strictly controlled movement via quarantine and social distancing. They expanded their hospital infrastructures very quickly with 3 new hospitals and 16 temporary hospitals in Wuhan. They did swift testing development. But what they did, I think that was quite extraordinary, is they had rapid deployment of 40,000 healthcare workers to Wuhan, and they sent 15,000 epidemiologists to do aggressive contact tracing. And it's about contact tracing and isolation and quarantine that I think helped China's ability to stop this epidemic. As again, unprecedented surveillance. They even had drones that sensed temperatures and determined who in the crowd had a fever. The benefit was that with these drones, the police were able to enforce strict social distancing and monitoring fever. Hong Kong took a similar strict social distancing. They implemented this very early in the crisis. They prevented at the beginning, when they had international travelers coming in, they quarantined everyone and even gave tracing bracelets to those coming back so that they could keep tabs on where they were being quarantined. And interestingly enough, they had daily public releases of COVID positive cases. And this information, you could go online. It had the data positivity, symptoms, street location. So you knew in your building who was positive, date of discharge from the hospital as well. It was de-identified. There were no names, but obviously there was quite a bit of information that was released. So why did I think about these 4 responses? Because I think they all had something in common. For one thing, Singapore, Hong Kong, China, and South Korea all had extensive, a first preparation, a first run with the 2003 SARS-CoV-1 epidemic, which had about a 30% mortality. So they were set up to do aggressive fever and fever clinics. They had swift and decisive physical distancing. They had aggressive, transparent testing, and they had frequent coordinated public announcements on a daily basis. I did want to spend a few seconds talking about a very interesting public health experiment in Vo, Italy, which shows that containment is possible if you test early. And this is, as you know, Italy is a hot center, but this is a town of 3,300. When they had the first Italy death, they closed the town's border. They implemented mass testing of all residents in February with no new cases. Mass testing, even if you were asymptomatic. And what they found that 3% of residents were positive. They quarantined them, they isolated them, and they did second testing several weeks later and found that had dropped and actually contained it. And since March 23rd, they have not had a single case. Iran has an interesting clash of religion and public health. It was very interesting to see the Iran curve dramatically go up at the beginning, and one asked why. And this was an interesting class of religion and public health. This had to do with the fact that in Qom, Iran, they had 700 Chinese Muslims coming from Wuhan that actually went to a very sacred shrine where they actually licked and kissed the shrine. This obviously caused massive viral dissemination, and still to this day, it's been very hard to interfere with this shrine in Iran. They have now done aggressive, punitive violation quarantining. So we've had a diverse global response to COVID-19. We see how United States has surpassed China, but we've done this not by so much a unified public health messaging. We have state-by-state health policies. CDC cannot go into a state without being invited. We've had lack of testing, which Congressman Barry talked about. We've seen in India massive lockdowns forcing massive migration and obviously congregation that is not good for migrant workers. And I think you're going to hear from Jason Wang, a real success story, which I didn't touch upon, which is Taiwan with big data analytics. I want to end with this sense that we need to have this concept of interdependence, sovereignty, and shared global governance. Congressman Barry talked about this. This is not only for air pollution, climate change, but also pandemic infectious diseases. And I think the way that we need to go forward in the future is this concept of we need to have a healthy planet to have healthy humans. We need to look at the impact of our land use and deforestation, which moves these bats, which carry coronaviruses. We need to look at climate change upon emerging infectious diseases. We need to do surveillance to detect emerging zoonotic diseases in animals and humans. And if you want, we can talk later about what this concept of IHR and One Health is, which is basically looking at animal health as well as international regulations and global health security. And lastly, we need to have evidence-based interventions with AI helping us to build community resilience, to prevent, adapt, and respond to pandemics. Thank you.